Wheels for Wellbeing was originally established around sort of 2007 in Croydon by a group of parents, and they all had young people, children and adults they were caring for with learning disabilities, physical disabilities, a range of disabilities who just weren't getting any exercise, because we were very keen on making much better contact within the medical profession and also understanding the language that appeals to them, so that GPs would refer people to us. So it was a really wonderful kind of learning experience, even from day one. Part of it, as well as putting on this event, Winning Wheels, and inviting all these GPs, they also interviewed quite a few people in depth and wrote up a couple of case studies about how people's health had benefited from getting involved in the cycling, but also sort of the social angle, doing an activity where they're included, all their friends can go together.
Our team was working with a local organisation that provided refuge for women and children who were escaping from domestic violence situations. And naturally, kind of hand in hand with that, a lot of people were suffering from mental health problems like PTSD and depression and anxiety kind of things. What we ended up doing in the end was we came up with a workshop, so that a workshop for the people using the service that were in need of support with their mental health to attend. So it was hands-on support for them. Yeah, as part of the Team Up initiative, we devised a poster which did very well in the end. We ended up winning in the category of Best Legacy for an organisation, which was just fantastic. And also our team wrote an article for Safe magazine, which is the only magazine in the UK for domestic abuse, which is fantastic.
When we first started, so SHP gave us a very broad remit to our project, and just wanted something that involved health promotion. So we did some background questionnaires to find out what would be most helpful to their client groups. They work with a homeless population that has quite a significant proportion of health needs, and notoriously quite difficult to engage within sort of the classic healthcare settings. So we realised that what they maybe would want is to get involved with some exercise programmes. What we did was that we thought we'd start a walking group. So very simple, very straightforward, very achievable, something that they could then sustain after we'd set things up. So part of it was to develop a walking group, and the other part of it was sort of a health promotion, educational side to it for the key workers, so delivering a presentation to the key workers.
Something that I found was, because it wasn't so structured, because it wasn't work and it wasn't a practice placement, there was just so much more scope for like the collaboration between the different professionals to be kind of more creative and organic. Such a good experience, it's such a good opportunity, especially for people in the allied health professions, because there aren't a lot of, well, there might be other things out there, but I haven't heard about them and I haven't seen them kind of Googling opportunities. A really good experience with group work, which really helped kind of build my confidence, I think.
That's what the Team Up project helped convey to sort of the GP surgeries locally, and also other people, because one of them was an occupational therapist, and it's massively important for us to have really good relationships with that whole kind of area of medical model, as they call it. They would never have met, certainly never worked really closely together on a project, but they had such professional respect for each other's areas, so they were really interested. Oh, well, is that how you work? Oh, right, this is what I do. So I think that they learnt a lot from each other. I learnt a lot from all of them.
I'd say fun, educational, and rewarding.
Very rewarding, exciting, and fun.
Relationships, that's what it's about. 3 words. Fun, education, relationships.